And dear viewers, greetings. In this video, we are going to see about the capsulated cocci, Streptococcus pneumoniae. Before going to discuss about the Streptococcus pneumoniae, I like to provide some information about the viridans Streptococcus. Viridans Streptococci or Viridans Streptococcus are a heterogeneous group of alpha hemolytic and non-hemolytic streptococci, and this viridans streptococci is the normal flora of oropharynx, respiratory tract and gastrointestinal tract of infants, children and adults. Their group name is derived from the word viridis, that is in Latin its meaning is green, a reflection of a fact that many of these bacteria produce a green pigment on the blood agar medium. And nearly more than 30 species and subspecies have been identified under the category of viridans streptococci, and Streptococcus pneumoniae is the most virulent member of the viridans group or viridans streptococci. Other viridans streptococci can be differentiated from Streptococcus pneumoniae using an ophthalmosine test and capsule, because other viridans streptococci are ophthalmosine resistant and they also lack the capsules. Most strains of the viridans streptococci were highly susceptible to the antibiotic penicillin. And next, general characteristics of Streptococcus pneumoniae. The Streptococcus pneumoniae is gram-positive, lancet-shaped cocci, and regarding the arrangement, they are arranged in the form of chains and often having a diplococcal arrangement. And it is also called as pneumococci, and previously the Streptococcus pneumoniae was called as Diplococcus pneumoniae, and it is non-motile in nature and its size ranging from 0.5 to 1.25 micrometer in diameter, and it belongs to the family Streptococcaceae, capsules present and endospores absent. The mode of respiration observed in the Streptococcus pneumoniae is aerobic mode of respiration or facultative anaerobic respiration. The optimum temperature required for the cultivation of the Streptococcus pneumoniae is 37 degrees Celsius and optimum pH is 7.8. And regarding the habitat, these Streptococcus pneumoniae are widely observed in the respiratory tract of the human beings, and it was discovered by Louis Pasteur in the year 1881. Disease transmission of Streptococcus pneumoniae. Streptococcus pneumoniae infection are mainly transmitted by person to person, spread by respiratory droplets at the time of sneezing and coughing. And regarding virulence factors of Streptococcus pneumoniae, 5 virulence factors are widely observed in the Streptococcus pneumoniae. They are capsule, pneumococcal proteins like pneumococcal surface protein and pneumolysine, cell wall and cell wall polysaccharides, enzymes like autolysin, neuramidase, peptide permease and IgA protease, and finally hydrogen peroxide. The incubation period of Streptococcus pneumoniae infection is 1 to 3 days, and the infective dose required for causing infection is 10 to the power of 7 to 10 to the power of 8 CFU. Next, pathogenesis of Streptococcus pneumoniae. Initially, Streptococcus pneumoniae colonize in the oropharynx region with the help of the surface protein adhesions. And next, it spread into normal sterile tissues with the help of pneumolysine and IgA protease and stimulate the local inflammatory response with the help of teichoic acids, peptidoglycan fragments and pneumolysins. And finally, the Streptococcus pneumoniae prevents the phagocytic killing with the help of polysaccharide capsules and results in pathogenesis to the human beings. Clinical diseases caused by Streptococcus pneumoniae. 4 suppurative diseases are caused by Streptococcus pneumoniae. They are pneumonia, sinusitis and otitis media, meningitis and bacteremia. The first clinical disease caused by the Streptococcus pneumoniae is pneumonia. Pneumococcal pneumonia develops when the bacteria multiply in the alveolar space of the lungs, And after aspiration, the bacteria grow rapidly in the nutrient-rich edema fluid. The onset of the clinical manifestation of pneumococcal pneumonia is abrupt and consisting of a severe shaking chill and sustained fever of 39 degrees Celsius to 41 degrees Celsius. Most patients have a productive cough with blood-tinged sputum, and they commonly have a chest pain, which is also called as pleurisy. The disease is generally localized in the lower lobes of the lungs, so it is also called as lobar pneumonia. The second clinical disease caused by the Streptococcus pneumoniae is sinusitis and otitis media. Streptococcus pneumoniae is a common cause of acute infection of the paranasal sinuses and air. Middle ear infection or otitis media is primarily seen in young children, but the bacterial sinusitis can occur in the patients of all ages. The third clinical disease caused by the Streptococcus pneumoniae is meningitis. Streptococcus pneumoniae can spread into the central nervous system after bacteremia, infection of ear or sinuses. Pneumococcal meningitis is relatively uncommon in the neonates, and the Streptococcus pneumoniae is now a leading cause of death in children and adults. The mortality rate is 4 to 20 times more common in the patient with meningitis caused by Streptococcus pneumoniae than the meningitis resulting from other organisms. And the fourth clinical disease caused by the Streptococcus pneumoniae is bacteremia. Bacteremia occurs in 25% to 30% of the patients with pneumococcal pneumonia and in more than 80% of the patient with meningitis. Bacteria are generally not present in the blood of the patient with sinusitis or otitis media. Endocarditis can occur in patients with normal or previously damaged heart valves, and destruction of valve tissue is common in case of bacteremia caused by the Streptococcus pneumoniae. Next, laboratory diagnosis of Streptococcus pneumoniae. The first is microscopic examination. Under gram staining, Streptococcus pneumoniae was observed as violet-colored gram-positive lancet-shaped cocci arranged in form of chains or diplococci surrounded by unstained capsules. In negative staining, unstained capsules were observed in the stained background. And the third one is quelling reaction. The quelling reaction is also called as Neufeld reaction, in which antibodies binds to the bacterial capsules of Streptococcus pneumoniae. The antibody reaction allows this species to be visualized under a microscope. If the reaction is positive, the capsule becomes swollen and appears to enlarge. And in motility test, the Streptococcus pneumoniae are non-motile in nature. And next, the colony morphology on culture medium. In blood agar, the Streptococcus pneumoniae was observed as gray colonies with alpha hemolysis under aerobic condition or beta hemolysis under anaerobic condition after overnight incubation. In McConkey agar, Streptococcus pneumoniae shows pink colored lactose fermenting colonies. And next, the confirmatory test for the identification of Streptococcus pneumoniae. There are 6 confirmatory tests. The first confirmatory test is optosin sensitive test. Streptococcus pneumoniae is identified by its sensitive to optosin. The second confirmatory test is bile solubility test. Streptococcus pneumoniae are lysed rapidly when the autolysins are activated after exposure to the bile. The third confirmatory test is inulin fermentation test. Streptococcus pneumoniae ferments the polysaccharide inulin and hence differentiate it from other streptococci. The fourth confirmatory test is CRP test for antigen detection. It is a latex aggregation test using the latex particle coated with anti-CRP antibody is employed. By this test, we will detect the C-reactive proteins. And the fifth confirmatory test is antibody detection with the help of indirect hemagglutinin test, indirect fluorescence test and ELISA test. And the sixth confirmatory test will be done with the help of molecular diagnosis, and the tests are polymerase chain reaction and nucleic acid probe analysis. Finally, treatment and prevention. Most pneumococci are susceptible to penicillin. Penicillin-resistant pneumococci are being increasingly documented in the current days. Macrolides are selected fluoroquinones with active against pneumococci and are available for patients who are allergic to the penicillin. Most penicillin-resistant strains remain sensitive to the third-generation cephalosporins such as cefotaxime and ceftriaxone, and all are still sensitive to vancomycin. For serious pneumococcal infections, treatment with a combination of antibiotics is recommended. Vancomycin combined with ceftriaxone is used commonly for the treatment, followed by the monotherapy with an effective cephalosporin, fluoroquinolones or vancomycin. Ceftriaxone can be used for treating meningitis. Amoxicillin is the drug of choice for treatment of otitis media, sinusitis and pneumonia. Vancomycin is also used if the pneumococci is resistant to ceftriaxone. And finally, pneumococcal vaccines, that is the 23-valent pneumococcal polysaccharide vaccine and polyvalent pneumococcal conjugate vaccine, plays an important role in the prevention of pneumococcal diseases. Dear viewers, that's all about Streptococcus pneumoniae. Thank you for your support. Thank you.